Welcome back, whiners, to another episode of Adultish Wines. I'm here with my, I'll say friend first, because I do feel like people get offended if I put friend after. David Clay, who I met because I'm an old lady and have a broken body, and he was my hip physical therapist. So technically, Dr. David Clay.
Technically speaking, I don't go by Dr. David Clay, but I have my clinical doctorate.
That's pretty cool.
Yeah.
How many years of school did you have to go to? Like, what's the difference between a clinical doctorate or what you are?
And so, I mean, I'm a clinical doctor. 4 years of bachelor degree, right? You get your degree in whatever.
Okay.
It can be geared towards the physical therapy, whether that be kinesiology or athletic medicine. Some of my classmates who had the better grades in our program, physical therapy school, were art majors. And they just decided art wasn't lucrative enough for them. So they went back to school, took the prerequisites that you needed for physical therapy school, and went back to that. But all in all, it's 7 years of school. It's about 4 years of bachelor degree, then 2 years of physical therapy school didactic work, which is just like all the...
Didactic?
Yeah. Like just like all the reading and textbook tests and all the stuff
because you can really fuck somebody's body up.
Absolutely. That's still a chance. I'm still young in my career, you know.
Yeah. How old are you? Can I ask?
I am 28 now.
Wow.
Yeah, I'm getting up there.
That's pretty cool.
Yeah.
That you've already accomplished all that.
Yeah, you say that, and some of my classmates were turning 23 when we were in school. It was crazy. It's
when
crazy.
they were graduating or starting?
They were like starting. Oh,
yeah.
I just turned 21. I can drink now.
Oh God.
Right. Some of them were turning 21, getting into PT school, and graduating at 23, 24. But I've been at it for about 2.5 years now. So I guess, I graduated around 25. So it's a good age, I think, to start your professional career.
Yeah. Okay, that's so cool. So obviously, as you guys all know, I've talked about a lot. I don't know the name. I was going to say,
I'm your backup therapist, by the way. I was your replacement.
But do we actually refer to you as that? Because I guess Nick was my first, no shade. I love you, Nick. I really did. I was like, oh, bye, Nick. Nick was my first physical therapist. Mm-hmm. After I had hip surgery, they want you to go to physical therapy literally the next day.
Absolutely. Like still to this day.
I could not believe it.
You put that huge brace on that stops you from moving your leg.
You're still totally fucked up on...
The drugs. That's the best part. We can move you. You do a lot better your first day than you do like the second or third day you're back with us, right?
Because I don't feel?
Because the drugs are worn off and now you're not like in cloud nine. Right? Like now you're like, oh, I can actually feel when you move my hip.
Right.
Before it was like you're still a little buzzed off of the medication. They give you the good stuff when you go into surgery.
Oh, they definitely do. I woke up wanting like a burrito, and the nurse was like talking to my friend that was picking me up, like she wants a burrito, but like after this, you really want something pretty mild, like in case there's nausea. I was like, I want a burrito.
Give me Chipotle or Cabo Bob's.
I've not been to Cabo Bob's yet.
I think Cabo Bob's is arguably the best burrito spot for like fast food out right now, and it's in Houston, it's in San Antonio. I think it originated in Austin.
Okay, so it's a Texas thing.
It's maybe it's somewhere else too, but it's like here's Chipotle, and like Chipotle
Cinco loves Chipotle. Have you had Cabo Bob's? No.
Cabo Bob. I think there's only one in Houston, and it's off of I want to say like Westheimer
or something. Yeah.
Or Post Oak could be. It's right by REI. That's how I like.
Yeah.
It's in the Galleria-ish area, but I think Chipotle is very clean, right? You think about very clean meat, terrible queso.
Is it?
But
really?
very
I think Chipotle dirty full. I'm gonna have the shits for days.
I guess when I say clean, I mean like not crazy seasonings on it, and then you got Freebirds, which is like you can get like wild, and there's like definitely like some grime in that meat, and the people that. But it's fun. It's a little bit more fun, right? Chipotle is like, oh, my white collar dudes are gonna go eat Chipotle. My blue collars are gonna eat Freebirds. Cabo Bob's meets you in the middle.
Okay.
And their tortillas are so fresh. Dating Gabby, I found out a lot about food.
Oh, yeah. I forgot I was supposed to introduce you as Gabby's boyfriend.
Oh, yeah.
She said you would love it.
No. But no, dating Gabby, not that. One thing we bond over is food, and I hate that I always am talking about her. But I'm just like, man, am I obsessed? But
you're simping. Is that the term? Is that what the kids say?
Simply me. Yeah, I'm simping. I think simping is the way to Way to go if you want something long term.
I love you.
I know Cinco has different views.
That's the right answer.
But Cabo Bob's is a nice like meet in the middle. In dating Gabby, she just always knows these like little niche things about fast food restaurants and other restaurants too.
Interesting.
Like one thing a lot of people get, and you may get it. I mean, you're white. Cheesy gordito crunch.
It's gordita.
Is it gordita?
And I would know. Cheesy gordita crunch.
Did you know you could sub a Doritos Locos taco shell in there?
No.
Didn't know that until Gabby and I went through the drive-thru.
I don't go to Taco Bell sober. I've never had Taco Bell sober a day in my life.
So you wouldn't be able to actively make that decision.
Correct. I just want what's on the menu. Don't fuck it up. And don't forget the sauce.
The hottest one they got, right?
No.
Mild.
And I use a packet on every bite. One whole packet, every bite. When I used to live with two of my girlfriends in Hermosa Beach, California, we had a bag of extra Taco Bell sauce. Like any extra sauce that we would come across. We would have a bag because so many motherfuckers don't put the sauce in the bag.
You're hoarding Taco Bell sauce.
In case of emergency. And then one year, that same friend got me Taco Bell in the bottles. You know, the sauce that they sell in the bottles?
It can't taste the same, though.
It's pretty good.
Is it?
Yeah. It doesn't have the little joke on it, but it's still good.
I didn't even know the taco. I've never looked at the sauce pack and saw a joke on it. That's a thing?
It's a little saying, yeah.
Oh.
Yeah.
Or you just usually rip it open and...
One packet every bite. Anyway, Cabo Bob's.
Okay, so Cabo Bob's. So take you back. The reason I went off on that tangent is Gabby knows like these niche things about restaurants. You get to pick your tortilla, like at Chipotle or at Freebirds.
Okay.
And I'm like, well, I've tried this one, but maybe I should try this one. She goes, why don't you just mix them? And I'm like, what do you mean? Like, you're going to like double layer it? She goes, no. And they actually have their tortillas. They're fresh. They're dough balls. And so you just smash them together.
Whoa.
Roll them around and then put them on the pan and start cooking them.
What's the different flavors of tortillas? Like it's not flour and corn.
No,
it's like something fun.
Yeah, it's like, I'm going to be completely
like sunflower
wrong.
And spinach or something
exactly.
like that. Okay.
Exactly. A little bit more fun than that, but yeah.
That's very white of me to say, wasn't it? It was like Jersey Mike's. Do you like Jersey Mike's? That's the shit.
Jersey Mike's is good. I think it's better.
It's way better than Potbelly.
I've never been to Potbelly, but I hear great things about Potbelly.
I'm not a fan.
We just all have to agree that the sandwich shop we avoid is Arby's. Right? Like, we got the meats. What kind of advertisement?
Wait. One time, like probably 10 years ago at a bar, I met some guy, and he was trying to come home with me. And I said, no. Anyway, I went to the next bar, and he ended up being like, saying it again, and I was like, man, you gotta at least buy me a spinach dip or something. That's always my go-to. Like, instead of a drink, I always just be like, you gotta buy me a fucking spinach dip. You know what I'm saying? Like, anyone has them. Chili's, which, terrible. Cheesecake Factory, like, there's levels. Yeah. You know what I mean?
Yeah.
Steak 48, definitely got some sort of dip like that. Anyway, I was like, you at least gotta take me out for a spinach dip. And he said something like, nah, I'll get you McDonald's. And I was like, wow, 2 for 1. Wow, I'm impressed. And I was like, at least Arby's. And he's like, we got the meats. It almost made me want to say, okay.
Yeah, like, hey, you're kind of funny.
That was funny. I used to fuck with Arby's.
Did you?
I don't know why. Is it a poor people thing? Did you grow up poor with money?
No, I didn't. I definitely grew up poor.
And you didn't fuck with
I couldn't afford Arby's.
Well, maybe it was just grimy that, I don't know.
I don't know. Arby's is just like, I've never actually tried Arby's. But I'm not going to. Have you seen their commercials?
No.
And then just the reputation they have.
Did you ever eat tuna fish sandwich from Subway?
No. I mean, it's not real. They went through that lawsuit. And
I used to eat tuna fish sandwiches from Subway.
You thought you were eating tuna fish sandwiches. They went through a lawsuit, right? There was a scientist that took samples of tuna from multiple Subways in like their county or whatever.
What was it?
Went back to the lab, researched it, and discovered that there was no actual fish inside of that tuna.
What is it?
I don't know, Paige, but your body has been digesting it and processing it for years.
I don't know, Paige. That was aggressive. That was like, fuck you. Anyway, okay, fuck the food.
Yeah, sorry. I don't know how we got
anyway,
to Cabo
Gabby
Bob's.
knows best. Gabby's your girlfriend, who we're going to get into. So David was my physical therapist.
Yes.
That's how we originally met. My original physical therapist was a guy named Nick, who shout out. But I
Shout
do
out,
think
Nick.
he was intimidated. Not intimidated by me, but I think I was a lot for him. I'm going to be honest. Like, I'm a lot.
Yeah, Nick is definitely like very calm, very mellow dude. Funny, definitely if you know him personally, but you were up here And Nick was like definitely right here. I think the only reason you ended up with me is because you were so like up here, outgoing, that I was like, this chick is funny. I gotta like make conversation.
Yeah.
And it was just natural for me. Yeah, for sure. I'd be with my patients and they're like, kind of boring. Some patients definitely have like more boring.
I can't wait to talk
exercise
about boring
regimens.
Patients.
And then here's you like laughing, but while stretching in the corner on the turf field, about to do some warm up and just Nick's ear off the whole time. So it was.
Was he just talking shit about me?
No.
Honestly,
Nick,
I mean, he doesn't work for you guys anymore, with you anymore. But what? Tell me.
The thing is, like, Nick loved you guys. Like, Nick, you would never be able to tell it by his facial expressions because he shakes his head. But that was
I'd
probably
always
like
try and break him out of his shell a little bit. You know, like one time I laid down on the thing. He like went to touch me. I was like, "Don't touch me." He's like, "What?" I was like, "I'm sweaty." He's like,
Poor
I
guy.
gotta touch you. And then I was like, listen, I've been coming in here for 6 weeks and you still haven't found me a fucking husband. What's the deal? And he's like, what's your type?
Tall.
And then when he was
6 foot plus.
6'2" plus. Come
on. What's 1 inch? Yeah.
So then you became my physical therapist because he got a job, which, you know, he transferred over
minor
somewhere.
league, in Arizona.
So he's working on finding me a husband is what you're saying.
I thought you gave up athletes, though.
David is an avid listener of the podcast, and he holds me to every goddamn thing I say.
90 days, no athlete.
Did I actually say 90 days?
Yeah, you did. I think you did.
Every time. So I also play volleyball with David. During the end of my physical therapy, like when I was becoming stronger and stronger, he's like, let's start doing some volleyball drills. Because I think that's how we bonded. You were like, oh, I just finished playing volleyball. And I was like, I play volleyball. And you were like, no, with that hip you don't, you fucking idiot. It's like... I'm going to, though, one day.
It was a good goal.
It was a good goal. And here we are.
Yeah.
And so then that was my first volleyball. I talk about volleyball on the podcast, of course, as you know, because you listen to it. But I felt so comfortable with my first team because I had you. I had 2 other physical therapists.
Yeah.
And
a PA.
And a PA. And I didn't know that that's why you named it. What did you name it?
Hip, hip, hooray. I thought it was very clever.
I didn't get into like the end of the season because I had a hip problem. They were my hip physical therapists. I thought it was very clever of you.
Yeah, thank you. I put a lot of time and effort into figuring out that name.
How sad was it when nobody like knew that you did that on purpose?
I think everyone knew it but you.
Oh.
I had discussed it with Derek and Alyssa before.
Oh.
And Julia's just like pretty smart, so I think she picked up on not that you're not.
Okay, all right. This is like a roasting page session.
That's our relationship.
It's fine. I can take it. It's our relationship. Okay, so Dr. David Clay, physical therapist. What? You do 7 years of school. My niece is going off to Montana State into Bozeman she wants to be major in kinesiology.
Nice.
Is that what you majored in?
I majored in kinesiology with athletic medicine kind of like focus.
I think that's what she's doing.
Does she want to be a physical therapist? There's other avenues definitely with it.
What's another option?
I mean, people become athletic trainers. People become PE teachers, coaches.
Athletic trainer. She wants to do what like Nick's doing, like working with.
And you can. And I definitely, if she's going in that route, I would suggest becoming an AT before you become a PT. A lot of the major league, minor league, pro like sport teams, therapists, they're a mix of, they actually have their AT license in their physical therapist.
Mm-hmm. Okay.
The athletic, I got to stop speaking in acronyms. They have their athletic trainer license, but then they backdoor and get their physical therapy license. They're called ATPTs.
Okay.
And that's what makes them more marketable to a lot of these pro teams.
Okay. That makes sense. Yeah, I tried to introduce her to Nick to like get a little bit of information before she chose school, but you know, teenagers, they just really don't listen to adults, even if they're their favorite aunt.
That's pretty cool, though. That's really cool.
Yeah, she's excited. I just was in LA visiting her, going away party, doing that. I surprised them. Very cute. That's why I wasn't at volleyball last week. I'm beginning to think when I don't come, you do win. So is there anything you want to say to me about volleyball at the moment? Am I like the weakest link on the team?
No, we definitely won with you there. You just happened to not be there for the playoffs.
And for championships for this last week.
For the playoffs. For last week, it was just the teams we played were not the best.
Okay.
One of the teams was the one we beat in the last game to win the championship. Another team, they had some good, decent people, but there was one girl that just wasn't with it, and we would just push the ball to her. That's what we do.
Yeah.
find the weak link and attack it.
I'm not good at finding the weak link, though. I don't want to find the weak link.
You feel bad about it. That one guy hurt himself, and you were like, let's not hit it to him. And I was like, no, he's the most athletic person on the court. Don't feel bad for him. If he's down, attack him.
And you know what? I think he was a big fat liar. I don't think he was. I mean, I do think he like injured himself for a second, but like I think he was milking it.
And then he came back and started jump serving and went on like a 14-point run on us.
I thought you just fucking tore your Achilles, man. What's going on?
And I was like, this is why we can't take it easy. When we got someone down, take advantage. Like, that's just like a very competitive, I think, thing too. When you're playing sports and you grow up playing sports, your job is to find some of those weak spots, and you just.
I was never good at that. I'm not competitive in that way.
Yeah.
I do think that, like, and correct me if I'm wrong, I think we get along really well.
Absolutely.
I think you're close to wanting to murder me during some volleyball games. At least that's what your eyes say.
No, I think.
You know what I mean? Like, sometimes I, like, say something or, like, have a bad say, and you're like, I don't know. You don't say much, but you look at me and, like, he hates me right now.
No, I'm just like, hey, can you put the ball a little higher? No, I think in sports, in general, I get more upset with myself than I do anyone else. And then so what they may look like is like I'm angry at you, but I'm really just that's the face I'm making toward myself. I just can't see myself when I'm doing it. But I'm definitely more upset and disappointed in myself for not making a play or not making a move or being too lazy to move here. I think the one play where I did look at you and I was like, I don't know if we can cuss on this podcast. We're like, what the fuck, Paige?
Yeah, you can.
We're like, what the fuck? And I think we all did it, and then I felt bad afterwards because you can definitely tell you're in your head about it. But it's like final points of the game. You're our setter, which means second hit to you, right? Like, first person touches the ball, they pass it to you. You set either me, Connie, or just even push the ball over the net. And Gabby, like, it's pretty far out. She digs it, passes it to you. Ball's floating over your head.
It was not over my head.
It was Paige. I was back right corner. Gabby and Connie were like way left. You were dead center in the middle of the court, and you're like, "Help!" And we're like, "Paige, get it! It's right there."
It was too late.
We're like, "You're the closest person to the ball."
It was too late. That's why I need.
So Connie jets from like 5 yards out. I don't know if there's 5 yards in the court, but he jets from like way over here.
You're over dramatizing.
No, when Connie jets from the left side of the court, he's already dying. Like, I don't know if you've seen it in Connie's face, but his soul left his body that second game, and he was not there.
Well, maybe he should make it out to the field a little bit more often.
That is his own doing. Yeah, that is his own doing. But it was
we're all out there in the heat.
It was also 104 and 5 degrees. Yeah, we were
all
gone.
It was all after white linen night, hungover as shit.
Because of those drinks that you had. I had like 8 of those little, like those things, and
well, that sounds like a personal problem.
I wasn't doing too hot that night.
No, none of us were. Yeah, that was bad. To be honest, and I almost went to like explain myself after. Not that it was like premeditated, but as the whiners know, and as my physical therapist, by the way, like you should have a little bit more care for my well-being. Usually after like an hour and a half of playing, my hip starts to hurt.
I wonder why it's after an hour and a half.
I know. I don't know. I think that sounds really made up.
Do you expose yourself to, and here I am trying to like diagnose you, right?
No, diagnose this bitch.
Do you expose yourself to like longer durations of exercise? Like when you're in your gym sessions, have they ever went over an hour and a half?
No, they're an hour. Or 45 minutes. So
you train for an hour or 45 minutes, but you ask your body to put on its performance for 2 or 3 hours. It's a big ask for an injured...
Sometimes I have sexual performances that last
like 30 seconds? 3 minutes?
They're just like repetitive, so it's like a few, so it comes out to like a couple hours.
Guarantee.
I guess there's a rest in there.
Guarantee your sexual performances, no matter what you're doing in there, God help us, you're not as intense as you are in this 4v4 stand volleyball court at 105 degrees, unless you turn the heater on. Let's do some hot yoga in this piece. And then poor guy or girl.
Oh. I've never told you about a dating story with a woman.
I don't assume until you know.
Okay.
But my suggestion would be exposing yourself to longer periods of exercise. It doesn't have to look like intense weight room training the whole time or doing like plyometrics in the gym for an hour and a half. Because a lot of people's bodies tend to crash after that much time anyway. Like whatever you do after that hour and a half, 2 hour time, you got to be very intentional. Otherwise, you're breaking down your muscles more than like helping them out.
Yeah.
And you're like, you're doing more harm than good. But a long bike ride would be exposing your hip to like repetitive movement. And you can ride for 2 or 3 hours and not be super intense, but I know it sounds crazy, especially in this heat, but maybe go in the evening or in the morning.
I don't have a bike.
Yeah,
can I walk?
You can walk. I mean, who's going to walk for 2 or 3 hours? You can. But it just, we don't.
But I can't usually walk for 2 to 3 hours. Like, I can go on a, like, 45-minute walk, and then I'm like, it's getting a little
And
tired.
I will say, most of my patients that come in with labral issues being, Paige, you mind if I tell them? Because.
Oh, yeah, don't violate HIPAA.
Yeah, I can't violate HIPAA.
Yeah, no, please
But you've said it plenty of times on the podcast, I think.
You can say anything about me.
She has messed up labrums. You have hip dysplasia. You have
hip dysplasia.
Right. I thought you told me you had hip dysplasia.
I had a torn labrum and a hip impingement.
Oh, okay. You don't have hip dysplasia.
So is that dysplasia?
No,
okay.
Hip dysplasia is something different.
Okay.
Which is common in like female athletes when they
I don't know if you guys heard that, but he said athletes.
Female athletes, yeah. When you guys did sports,
I'm an athlete.
You are. I mean, you compete in an athletic event weekly, and you've been doing it for months now. We've been doing it almost a half a year, right?
In the summer fucking heat.
Yeah.
I don't know why we're doing it. Okay, anyway, so labral tears, yes.
But yeah, so you had labral tears, you had impingement, which means like for some reason your hip is getting stuck and caught when you bend it in certain ways.
Yeah.
I honestly forgot where I was going with this. But walking, my patients that go through that and experience that, one of the most common complaints are even patients will say, this pain onset when I went for a 2-mile walk. This pain started when I went for a 2-mile walk.
Yeah.
I started to notice it. Hasn't went away since. So walking, I feel like, can be strenuous on the hip capsule, just from, not from like any research I've done, but just from patient care, working with patients with labral injuries, and then being like, yeah, just this repetitive motion of it, flexing my hip, then extending it, and really, it's usually when the hip is back that they get the most pain, and it's because of that, the way the capsule is like shaped and how it works.
So I shouldn't stop walking, no, but I should start easing into more walking, probably. Ease
into more walking and introduce other various forms of like cardio, right? Don't let walking be your only thing. There's other things you can do. You can bike. I mean, Houston has bikes you can rent. I've had friends ride those and it wasn't pretty, but they have bikes you can rent.
Why? They're like rickety or something?
Huh? Yeah. I have a road bike. And so when we're riding road bikes and then they ride those bikes, it's not the same. My bike is like 8 pounds and those bikes are like 20.
Sometimes when I get on a bike, because I don't do it very often, I get a little nervous and I feel it's unsteady.
And the slower you go, the harder it is to balance.
Yeah. So that's a little
Just
scary.
go. I mean, falling is inevitable when you're riding a bike outside.
I am so worried. I think I get in my head a lot about, like, I just recently, I mean, I go to the gym often, obviously, but he was having me, I want to start, like, hitting more, and so we're going to start incorporating more sports performance as well as strength.
Oh, hitting, like at volleyball.
Yeah.
Okay.
In my training. And so he was having me do box jumps.
Love that. I saw that.
Yeah.
I was excited. I was like, man, she's about to get up over the net.
I am going to. That's my goal. But I get really scared. Like, he's like, okay, do this. And I was like, I can't do that. And he's like, I think you can. Like, first of all, you're huge. He didn't say huge, but I know that's what he was thinking.
I was like, wow.
No, he's like, you're tall. You got this. You're athletic. Let's go. I'm like, I can't do it. I can't do it. I get in my head. I'm scared I'm going to get injured again.
Yeah, fear.
I'm
Fear
scared.
of re-injury is like a common cause of injury. That's why we keep certain patients in there so long. It's like, hey, we just want to make sure that you're confident in this leg and you can do with this leg what you do with your other leg so that you're not compensating here like for a long time out, because that increases your risk for re-injury or injury on the other side. Well,
that's what happened. So now my other side, the non-surgery hip, quote-unquote good hip. Well, actually, I do have a torn labrum. No. I have hip impingement in the other hip, I think. Yeah. At the time of the MRI, they told me, but it was never hurting before. And now that's the one that's acting up. So you were saying at volleyball, you had me do like a little squat situation. And you said I had a what? A knee?
You have like...
I'm fucked up.
It's going to sound like crazy term. No, you're not messed up. I think some of the things that you present with are very functional, which, right, like I haven't seen your MRI or X-ray. I haven't went back in your chart and looked. I think it's pretty illegal for me to actually go do that. Go back and be like, hey, I know Paige. Let me go back and look at her chart.
Okay.
View her previous X-rays, MRIs.
Yeah.
I would need to be currently treating you or working with you to go look at that. But
don't do that.
I won't. But just looking at some of your squat mechanics, everyone's good at squatting with 2 legs. I mean, we think they are. We hope they are. But when it comes down to one leg, as soon as you would squat, your knee would just shoot to the inside, and they call that a knee valgus instability. And that can come from a lot of times it's from your hips, like hip weakness on the outside, really like some reduction in like glute strength and quad strength, just like weakness throughout the chain. And you should be able not only to squat with like keeping your knee kind of in line with your hip and your foot, you should be able to like do single leg hops, especially with someone who's jumping constantly, like, on a Sunday evening. You should be able to do a single leg squat, single leg hops, if you're going to ask your body to do those things. So not only are you doing those things repetitively, you're doing them on a sand field, essentially, a sand court. And so
wobbly.
You can't, unsteady. And so your body, you got to be good and strong enough to correct that posture so that you don't keep jamming you. I haven't evaluated you yet.
I know, but like just thinking that was my thing.
That's one thing. I evaluate. That's one of my movements out of like all the tests and things I do. That's just one
thing that's wrong with me.
That's just one movement I use to evaluate certain things. That's very like, it was like I said, it was very broad, very like, hey, I look at people lunge, I look at them squat, but I also like to isolate and test specific muscles to see where you're compensating, where you're weak, and see if this is something that, hey, I think this will work, we can train and can fix this, or are you going to need surgical revision? We try to avoid it when we can. We want to avoid a blade at all costs. But sometimes it is necessary.
Yeah, I do want to avoid a blade at all costs, let's be honest. However, I just have a hard time believing, and this is going to be your floor to just tell me I'm wrong, hopefully. I have a hard time believing that, like, okay, for this issue I have, it's hurting once a week, after I work, after I exert for this long, that I can fix it with physical therapy and not surgery. I get a little, like, doubtful.
Yeah. I think one of the things you said that's very positive, right? Like reassuring that, hey, maybe physical therapy can fix this. You only get this problem once a week.
Okay.
You only get it after playing volleyball. When you start looking at things that you want to do surgical repair for, man, I wake up with this pain. It changes, it alters the way my life is. I can't go to work. I can't work out regularly. You do workouts and you do fine. You do your stuff throughout the week. Just when you come to this sand volleyball court, we play for 2 to 3 hours and win or lose, out in the hot sun. Afterwards, or even during, kind of toward the latter end of our games, you start experiencing this hip discomfort, and it hangs around throughout the evening. And by the next day or the next 2 days, it feels better. You haven't done anything to really address the specific issues because we don't know what they are just yet. We haven't tested it. And just so you know, guys, I've invited Paige over, said, hey, let's set up a eval so I can evaluate your hip. I won't charge you. I won't charge you.
You're not charging me if I'm coming to your house.
Yeah, I mean, PT can be expensive, though.
I'll bring you... Yeah, I fucking know. I'll bring you a bottle of wine.
You saw that,
like you did. We're drinking wine that David brought.
Yeah. That Gabby gave me.
Oh, thanks, Gabby.
No, but
did she tell you to bring it too?
No.
Oh, it was just, that was your idea?
Yeah, it was just one of my bottles on my wine
rack. Good
rack.
on you.
Yeah, I was like, I'm going to Adultish Wines. I should bring a wine.
Yeah.
And not just like the spoken one, but actual physical bottle of wine.
All wines.
Yeah, exactly. But no, I definitely think at this point, with what we know thus far, you probably have like a functional impingement. I mean, if they've seen it on an MRI though or X-ray, you probably have an anatomical, which means like your anatomy is just off a little bit to where you can get an impingement. If they're seeing it on imaging, functional impingements are like, we don't see anything on the imaging, but something with the way your hip moves causes it to get stuck, and that's a functional.
Do you know what causes an anatomy? What is it called?
There's a cam and there's a pincer impingement.
I don't know which one I have.
So cam, and this is like real like nerdish, right, of me.
Before you say that, I want to highlight, and this might lead you to what I have. I remember Julia, who was what is her title?
She's a physician assistant.
Okay, physician assistant. She told me, like, and I was like, when did this happen? She's like, well, it typically comes in young women, or that's when you notice it, type of thing. So
she's saying you're still young.
No, because I've had it for 10 years.
Oh, okay.
I had that problem.
That makes
for
it
10
hard.
Years.
Yeah.
So does that lead you to?
I mean,
the pincer or the other one?
Not really. No. I mean, I guess you can probably say it's more pincer. Pincer being, I mean, your body. I don't know if people can see me, but your body is. Yeah. Let's say this is your leg, right? This is what they call your femur. This is the ball. The hip is the ball and socket joint. Here's the ball. Here's the socket. Here's your hip. That's how it happens.
Yeah.
Probably a little more space in there. It moves around until you can move your leg different ways. Inside of here is a lining called your labrum, which you've mentioned before. You've had tears in. Sometimes, pincer-wise, that you can have like a bony growth, like this part of the capsule starts to grow a little bit too much, and it starts to catch on the bone here, and that'd be a pincer impingement.
Okay.
A cam impingement is, for some reason, there's like a bony growth or like change in the structure of this head, and now there's like bone sticking up, and you're trying to rub smoothly.
It's that one.
It's cam impingement.
Yeah.
And it's getting caught every time you.
That's what it was.
But not all of them are significant enough that they require surgery.
Right.
Sometimes you can just strengthen the muscles around the capsule and improve really the space and then how it moves, and it's just enough to like skip that little hitch.
So it is possible to heal without surgery.
Absolutely. There's actually, I don't know the statistics. I'm not going to throw out a random stat. There's a good amount of people that have labral tears and impingements. Never notice them. Asymptomatic.
Couldn't be me.
I mean, yeah, it's not you. 10 years, though. 10 years is a long time to have something and not get it treated.
I was in pain for 10 years before I got it fixed.
Did you not have insurance? Or?
I had bad insurance, and I had gone a couple times. Like, I had sprained my ankles a lot. So.
That's just tall people stuff, man.
Weak ankles, weak hips. I could sprain my ankles a lot, and so I was on crutches a lot, and I just always was like, oh damn, my hip hurts because of the overcompensation for that foot, this foot, da-da-da. So I just kept putting it off, and then I was costuming on my feet for so long, and was like, I have to live like this, forever. This is me now. And then my health insurance with the union was about to expire because I stopped working so many hours in there, and I was like, this is my chance to go see if anything is actually wrong.
Yeah.
I had asked doctors previously, hey, my hip hurts, can you do an MRI? Because they've done x-rays. They're like, we can't see anything. Can you do an MRI? And they say, there's no need for us to do it. If you want us to do it, like, it's elective, and it's going to be on, like, we're...
Is that in California?
Yeah. I was like, well, fuck that. No, I'm not doing that. So I waited, and then finally went here, and they were like, yeah, girl, you fucked.
And you're also in a good place, though, right? Like, I feel like if you're going to have anyone operate on your hip, it's Dr. Harris. I
lucked out. I had no idea he was like the guy. Mm-hmm. He's the guy.
He's the guy. There's not many people that do what he does. There's not many people that do what he does.
That do what he do.
They do what he do. If he wouldn't have did what he did, you would have been where you had to get what you got.
No, I do feel so lucky.
Yeah, absolutely. And then back to back door, you got Julia as your PA. Sweet woman, very awesome. And then you get me and Nick as your PTs.
Sweet guys, very awesome.
You just couldn't be in a better spot.
I know, it worked out. Okay, so besides me and how amazing I am as a patient, what kind of shit do you see? By the way, I've mentioned David on the podcast a couple times. 1, volleyball. 2, my physical therapist. 3, he also doesn't believe in telling people that they have shit in their teeth.
That backfired on me recently. It backfired on me. Karma hit me hard. I was in a rush, brushing my teeth. I woke up late for work. I see 1 to 2 patients on the hour every hour. By my 10 o'clock patient, and I'm usually double booked every hour. I'm usually seeing 2 patients every hour.
Okay.
It wasn't until my 10th patient, and this is how I knew they were like a good patient. They were like, hey, bro, you got something on your mouth.
I love that you just said it was a good patient, because that is polite to tell somebody.
It was toothpaste. You
had toothpaste all over your face, and no one told you until your 10th patient.
Yeah, I was like, I can get if we were still wearing masks, but my mouth is out there now. So yeah, it was just.
So now are you gonna tell people straight up?
It's just still uncomfortable. I'm an outgoing introvert, so I think some of those, like, I'm not a very confrontational person at times, so I think some of those things are just.
That's not confrontational. You just said how much you appreciated someone telling you.
And I'm thankful that they're so like outspoken and it can do that. But for me, hey, bro, you got something in your teeth that's like black, and then the awkwardness of watching them do it. A lot of people aren't going to excuse themselves, go to a restroom and fix it. They're going to try to do it right there in front of you.
You know what I do a lot, and this is going to cause some concern from people, is if I don't have something if I can't walk away or whatnot, I take out my hoop earring because I wear them. I literally will take out my hoop earring, and
the amount of bacteria that you just expose yourself to. Oh my goodness.
Your face.
The amount of bacteria. You gotta sit in one of our trainings with like bacteria and
I put worse things in my mouth than in the back of my hoop earring.
What's more greasy and like smelly than the back of your hoop earring? How often are you cleaning your hoop earrings?
I think never.
And then lastly, are they real gold or is it like sterling silver peeling off into your mouth?
Okay. It's absolutely fake Forever 21 shit.
Like gold plate, just like
But you
plastic.
guys you're not thinking of the reality of the situation. All you do is you take it out and it's just in the...
What's that on your hoop earring right now? What?
Nothing. It's just gonna be right at the like, where do you think I'm putting this all over my tongue?
Just use your nail.
No, it's not thin enough. Anyway, I'll use a straw if I have it at a restaurant, but if I don't have anything, a hoop earring's going in my teeth.
There's always like a business card close enough for you to use as opposed to your hoop ear. I could have ripped the rest of my life knowing that you don't use the back of your hoop earring to clean your teeth. You might get some people that unfollow you on this podcast.
Oh my God. I've actually suggested before. I've been like in the bathroom drunk at a club or a bar, like trying to get something out of my teeth, and I'm like, oh, just hoop earring. And some girls doing the same thing. I'm like, just take your earring out. Like, it's not, maybe it is wild.
That's wild. Yeah. I mean, but to each their own. To each their own. We all have our things, you know?
Yeah, that's my thing. I'm sorry.
Oh my goodness.
I don't think I've ever said that out loud before.
I'm excited for the feedback you get in the questions.
I haven't said it out loud because I'm self-conscious about it. It just hasn't come about.
You're a very honest person, though, and you're very true to who you are.
Thank you.
Just don't ever tell a guy on your first, second, third, fourth, or fifth date that you use the back of your hoop earring.
What if I did that in front of you on a first date?
Oh,
would
it's
you...
game over. Check. Separate.
Do you know what I do tell people sometimes on a first date? Well, so many things. I probably cross so many lines. But what I do tell people is if I'm eating, and I'm in the middle of a conversation, I'm still numb from my wisdom teeth surgery.
Just dripping drool all the way.
Yes, that has happened before.
You're still numb?
Yes.
You're not going to get that. How long has it been?
2 years. They said it could still come back.
Who?
The oral surgeon and the receptionist who had the same problem. I asked her how long it had been, and she said 4 years, but...
Okay.
Yeah.
You got 2.
She was still going. Anyway, and recently I was on a first date, and I thought they were looking at something on my mouth, but really I don't know what they were looking at. And I was like, I have to stop you really quick. Is there something on my face? They're like, no. Like, if there is, please tell me, because I tell them the story about I had wisdom teeth and still numb, and I just can't feel anything at all. And I would never call you back if I got in my car, looked at my rearview mirror, and I had fucking shit on my chin, and you didn't tell me.
But I think that's respectable. Like, hey, got a little like numbness, right? Can't really feel like this side of my mouth. Something drips out. Like, sorry, I apologize. You're pre-warning someone, but just to bust out your hoop earring and start digging out something, they're like, hey, you got something in your teeth. This is why I wouldn't tell you. If I'm going to tell you that you got something in your teeth,
I would not do that in front of you.
Bust your hoop earring. Did I get it? You're going to look for it. I already know you're going to look for it at the end of your hoop earring. You're going to just pull it off.
I don't look for it. It's just, it happens. I just go.
And then you're going to put it back in your ear.
Yeah.
You got to read the book called Bellevue. It just talks about different germs and like what that looks like.
I don't
and
read
how.
That.
Yeah, you probably don't.
I don't.
Just going to change who you are as a person.
No, I don't want that. Okay, tell me some horror stories or good story. Like, what kind of... First of all, are you a specific physical therapist? Are you like a hip guy, knee guy, neck guy?
As of now, I'm just kind of a general physical therapist.
Okay.
I work in the orthopedics and sports clinic, and so...
Again, athletes,
yeah. But definitely get like 98-year-olds in there, so... You know. Just so you know, orthopedics and sports.
Oh, okay.
But honestly, no, some of my 98-year-olds get after it. Like, I have a few that go to the Houstonian 5 times a week, and they're 98 years old. By the way, guys, Houstonian is like, you got to be rich to go to that place. I think it's like a $30,000 down payment or initiation fee, and then you pay like an extra $400 or $500 a month to go. But, that just makes me realize how broke I am.
Yeah, me too.
But I get a lot of, a good range of patients. hip, knee, ankle, elbow, neck, back. Probably see a little bit.
My back.
None of that. None of them. We got therapists for that. The next part. I think every woman carrying and postpartum should go see a pelvic health specialist.
You were
by
saying
the way,
this recently.
Yeah, it's kind of off topic, but I think
say it because I think it recently has become
more popular.
Well-known. Yeah,
I mean, I had a few classmates go out and become these pelvic health specialists. It used to be like women's health, but they realized that the guys deal with a lot of like trauma and troubles in the pelvic region as well. And then now they just talk about it as pelvic health. But women carrying, no matter how you give birth, your body changes, it's morphed, and there's things that go on down there. Morphed. It morphs, right?
Yeah.
To fit this
human
child in your belly.
Your body.
Literally, yeah. To fit this child in your body.
Yeah.
Your body morphs forward, and there's like different hormones that you haven't been exposed to that you release, and your body it changes. But during that, there's so much that happens, right? In order for your belly to expand, your abdomen, sometimes if it expands enough, it rips apart. They call that diastasis recti. It literally separates. You have this tear in your abdomen. And then you see people, and these ladies, and sometimes alcoholic men get it too. The older dudes with the beer bellies, they get diastasis recti. But as they sit up, you see their stomach start to like do weird stuff. It's like, that's not a normal stomach. Well, their abdomen's ripped. And then there's so many muscles down low, right, in the pelvic region, and you have like organs that like prolapse. And there's therapists that specialize in that. They help you regain strength in those muscles, help calm the trauma. Sometimes they have to be a little bit more invasive, but they specialize in that. And it's primarily women that treat it. Not to say that a guy can't treat it, but you just see more female physical therapists doing it.
Okay.
But I think the demand on a woman's body immediately after giving birth, they want to get back to exercise and doing things. And there's a right way to do that. But some of that stuff can be way too strenuous on your body. And you need someone who specializes and can show you how to properly get those muscles engaged, get your abdomen in a right spot. That way you can start to incorporate some of those exercises and activities that you want to do. That way you're not just, all right, let's just do it. And then now your body's starting to adapt and getting accustomed to being off.
Yeah.
And
would you recommend, I've seen women like on Instagram, I guess, that have not had children that are going to pelvic floor therapy.
Absolutely.
What would be the benefit of that?
And so
or the cause to do that?
To give you an idea, I'll use this example one of my classmates gave me. We were students, and she was telling me, and she says in Colorado, she had this couple that she had a couple come in. There was a woman that she was very religious. She just got married. Neither her nor her husband had ever experienced sexual intercourse. So it was their first time together. And they did not know how to do it. And so they were doing something so wrong that it was causing a lot of trauma to her in her pelvic region, that she actually had the man come in, essentially a couple's like treatment session. And she kind of educated him. She was like, had the woman there lying down, and it was like, everything out, and was like, hey, this is what this is. Really took the time to educate him and how to do like certain things, like this is where this goes. This is what could cause a lot of pain and discomfort.
Okay.
Doing it like this, and maybe like try this method and this method until you guys are more comfortable and more aware. Because not only was it he lacked education, but she lacked education as well. Because she was very traditional, very religious, and hadn't really experienced herself prior to him. And I think they talk about that a lot actually in lectures and stuff at some of these conferences that we go to. Physical therapy is like, hey, if you're a woman, you really got to know yourself before you can expect to explain that to someone else. Like, hey, this is what I like. This is how it works for me. This is my body. You got to really know your own body.
Oh, 100%. Well, I think that's why, kind of off topic, but kind of on, like, as far as sex goes, if you're having sex at a young age as a woman, it's just like not as great. You know what I mean? Like, you just don't know. There's no possible way you know your body well enough to know. Yeah.
And there's that. And then there was another scenario where there was a guy, and he fell on a hockey stick, and he had a lot of trauma. He couldn't get an erection because of trauma that he experienced in his backside. And then so the therapist had to go inside, right? They put a glove on, they lube up, they go inside, and they have to massage some of those muscles on the inner side of his his anus
Yeah.
to really get his muscles to calm down, and it carries over. And so he was finally able to retrieve an erection.
Okay.
But he's definitely an area I do not practice. Don't come to me for questions.
No, it's just
I stay
a
far
situation
back.
that you've heard.
Yeah, but these are very like niche professions, and I think pelvic health therapists should definitely be sought after more. And they are. They're like backed up. I told a patient to go visit one. Said, hey, with your problems, like I can work with you a little bit, but I think you're gonna be better with a pelvic health therapist. They specialize in this. She goes, yeah, they couldn't get me until like late October.
Damn.
And I told her this is like a month ago.
There's more. We need more pelvic therapists.
We need more, and I think there's a need for them, and we'll need more. Absolutely.
That's cool. Okay.
But I don't see anything like that. No. I see more of your general like shoulder pain, knee pain, people that just work desk jobs and end up getting the mid back pain. A little bit more of that. Whole nother story.
I went on a date with a guy once, and we were walking out. I told him all about my hip problems. Me just shouting, "What's wrong with me?" from the rooftops.
Hey, this is what I come with. These problems.
Yeah. You know what? If you can't handle me at that, you don't deserve me at my Beyonce, right?
I mean, yeah.
Can't handle a little hip impingement. Okay, fuck off. Anyway, we're walking out, and he's limping. This is the first time I saw him walking. I was like, "Oh, what's wrong with you? Is your leg asleep?" And he said, "No, I had surgery about 6 months ago. I think it was his knee." And I was like, "Oh, and you're still limping?" He's like, "Yeah, I mean, how are you not like after your hip?" I'm like, "Well, I mean, I don't know, physical therapy and stuff." And he's like, "You went to physical therapy?"
Yeah.
He didn't go to physical therapy.
Do you know?
I think something with his knee. He had surgery on his knee.
How old was he?
My age, 30-ish.
Yeah.
And I was like, "You didn't go to physical therapy?" Like, I just thought that was like, what do you mean?
No, not every doctor like suggested. There are still some doctors that don't believe in the benefits of physical therapy, and they won't send their patient there. Some patients, I have patients that literally will be like, "I had to beg my doctor to send me over here."
Wild.
I know a lot of times after patient gets like hip replacements. Hip replacements do well. Not everyone. I think everyone will benefit from physical therapy, but everyone needs it. Not everyone's gonna like be terrible if they don't have it.
Okay.
But they would definitely do better a lot faster with like some help and education if they got it.
Yeah. Real quick, what you wanted to talk about the difference between physical therapy and personal training, PT versus PT.
Yes. And so I think the thing with that is when you're a physical therapist, our job is to evaluate, treat pain, problems, issues that limit your daily function, like your livelihood, stop you from playing a sport. They're not you're playing your sport, we're going to get you stronger and faster so you're better at it. If you're not having like pain or issues in a certain joint or mechanical issues, then that's not really our realm. We operate in helping people get back to, we treat pain, we fix like mechanical issues, we really fix like joint abnormalities. We don't fix joint abnormalities, but we try to help you, try to help those as best we can with exercise and mobilizations and some of the other techniques and strategies that we learn in schooling and out. But after you hit a certain point, hit a certain wall, and you're coming into me and you're just looking for an exercise routine, I'm not, at this point, it's no longer medically necessary for you to see me. And you need to be kind of moving on and getting some independence with your rehab, because there's somebody else waiting.
To move on.
Yeah, you got to move on. And like I tell people, like if you're not comfortable with exercise, if you weren't exercising before you saw me, go see a personal trainer.
Yeah.
Right. I mean, I think you did a really good job of finding a personal trainer. I don't remember if I told you that or not, but I'm always like, hey.
No, I don't think you did, but I knew that I was either going to try and continue for a little bit longer with physical therapy and start working out. And it just so happened that when I went to a gym, I landed on my personal trainer.
Which is great.
Yeah.
And it's kind of like, it's a gray area because like, hey, like as much as I love treating you because you're like, there's nothing wrong with you. It's super easy to treat someone there's nothing wrong with. It's not my job. It's not with like, that's against what my practice believes. It's waste, right? It's not longer medically necessary. And I have a wait list of people waiting to get in. And we have you fill in this slot where you're doing well. Yeah. You're just scared to go into the gym by yourself. Well, I try to encourage people like, hey, as we start to phase out of rehab, let's get you into a personal trainer. I love personal trainers, by the way. I'm like, hey, if I can find some good ones, like my friend Josh personal trains, and I'm like, hey, I'm going to try to send these people to you just because I don't know any other trainers in Houston to help them out. But I really want you to make sure that you respect their medical history.
Yeah.
And don't push them past their limits, but show them what they can do. Don't let them live in fear.
Yeah. I mean, I'm just one patient, but I think that is so important because I really was scared first of all, I was scared to leave rehab. Like after I got my extension from insurance, I think I had like 16, a soft.
Hard visit max.
I had a soft visit max. Okay. So we got an extension for I think like 10 more. And then I was like, what am I going to do after this? Because it's a lot of responsibility to keep up with the exercises that you're supposed to do for your injury, but also go back to like living your normal life. Like I kind of was like, I mean, not addicted. That seems weird, but it was part of my routine I knew that I had physical therapy twice a week. I was I was safe. I was going to be under guidance. Like I was working towards an end goal kind of thing. Yeah. You get in a mindset of, and then they're like, okay, that's it. And it is kind of, I remember being like, scary. Bye guys. See ya. Never. I'll be fine. Don't worry about me. Like,
yeah. And I think with that, I try to get patients to give them some autonomy over their exercise. I'm like, hey, a lot of my patients didn't have time this week to do the movements. And I'm like, well, you found time to drive here, stay here an hour, and then drive back. I was like, I'm willing to bet there was a lot closer and more convenient option. And then you have a little bit more autonomy over what you want to do, right? You don't have to do these specific exercises. Like with you, it was just, hey, you can pretty much do everything you want. Just gradually expose yourself to it and avoid extreme stretches on the hip. Those are like your guidelines. But a lot of people get stuck on, I'm going to do these exercises you gave me for the rest of my life. Don't progress past that. If you stay doing those same things, you're not going to get any better. Start to add in other things. You like Zumba, go do your Zumba class. Just don't forget to warm up now and maybe spend some time strengthening your hip
Zumba
afterwards. I mean, tells you the patient population I see. But even some of the younger kids, I'm like, this can't be the only time you get after it, right? We get in here, we jump, we move. I'm telling you to go do this actively, but you had this whole summer and you wanted to lay around, but yet you want to make it to the pros. You got to really put in the work and really try to improve yourself.
Yeah.
Because no longer is it good enough to be the tallest person or the strongest person. I think people are evolving, kids are evolving, sports are evolving, and you really got to put in the work on your own. And so that's outside of physical therapy. I think a lot of people say physical therapy doesn't work out for them. I definitely think there are people that physical therapy is not appropriate for. It's just not going to work for you. There's more going on than we can fix. But a good amount of patients, they're like, I'm still hurting. I'm still in pain. Hey, how'd your exercises go on? Which one of them caused you pain? Oh, I didn't try them. You spend 2 hours in here a week. You think you're going to get strong from that?
Right. Preach.
No. Yeah. You gotta really put in work outside of here. And it's everyone. It's just 2 hours isn't enough to strengthen you the way you need to be strengthened or condition you the way you need to be conditioned. You got to be willing to do it outside. And there's people say they don't have time, and there's physicians that work 60, 70-hour weeks, and they still find time to work out.
There's always time.
There's moms with 3 or 4 kids, and they work a job too, and they still find time. There's always a space. It doesn't have to look like the same. They don't have to go to a gym, but even going for a walk on the treadmill, just kind of moving, taking care of your body, I think. And definitely,
I really appreciate. I don't know if it's because of the education that you've received, or maybe the way you grew up. I don't know, but I really appreciate how in tune you seem to be with, talking about women with their kids, they're still finding time to work out, and women after pregnancy with pelvic.
I was raised by women.
Okay, that's nice.
I think just took I was raised by my grandmother.
Okay,
and I had a sister, and so just kind of being around women, and then. With everything, I guess I grew up and I'm living in the time where women are speaking out more about what they've been going through. There's just a lot. And I listen to a lot of female R&B music. Love rap, but I think when it comes to R&B music, female artists right now are on top. And then, of course, Brent Faiyaz, Giveon, they're doing good. But
I don't know.
You don't know either of those artists?
Brent
Faiyaz?
No. It's my toxic trait is I'm not good with music. If I hear their song, I might know the song.
I'll send you some songs.
Okay, please do.
We were just playing Plies earlier. She's still
That's her age.
Wait, what was I playing earlier, Cinco?
Bust It Baby, or what with Neo?
Oh, yeah, that sounds right. If you get in my car, it's gonna be 1990s, 2000s, T-Pain, Timbaland, random shit.
Just a bunch of 90s, 90s R&B.
Yeah.
There's some good artists out there now. Daniel Caesar, Giveon, Brent Faiyaz.
Giveon or Gideon?
Giveon.
I thought it was Gideon.
No, it's Giveon.
Okay, I've definitely heard his name, but thought it was Gideon. Anyway.
Yeah, but no,
I'll be better.
I definitely think like
Cinco Young, he's a great music artist. And then you checked out his music. I know him.
Oh, you do make music, right, Cinco?
Yeah.
Where is it on Spotify or?
Yeah, Apple Music.
You have anything on SoundCloud?
Yeah, I got SoundCloud too.
You got to put your song on the introduction of these podcasts. You know, like.
I was telling him I need new intro music.
I got you. We'll do that.
Add it to the list.
Is lit.
It's lit. What a pleasure to have you on in this capacity.
Yeah, no, this is awesome.
I always appreciate you listen to every episode.
Everyone.
You've yet to leave a review, which I think is wild.
I had good intentions to do it before I came, but you know.
There's
no time. There's no time.
There's enough time in the day. Hello, physical therapy, workout.
I think what it is I write so many notes by the time I get out of work, I'm just like, I don't want to
irritating.
write anymore.
Yeah.
Especially when
I can
somebody like you is
imagine.
just talking the whole time. Patient reports, patient says, patient patient states, patient questions, patient. I'm like,
Are you fucking me up? Oh my god, you don't have to write all that.
subjective exam. What is the patient telling you?
That
We
she's
don't
looking
write.
for a husband. Da, 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 da.
Patient states that her hip hurts from like 3-hour things that she was doing. What'd you say earlier?
Sex or something.
Different, yeah, like sexual activity is what you said. 3 hours. Definitely done that. Like
But we don't have to worry about that now because remember, I'm born again. I'm not having
90 days.
It's not 90 days. It's just I'm waiting until it's the right person, right time.
So I think you said 90 days because of that one
Yeah, the
woman you had.
28 day girl that
Yeah.
I interviewed. I think that was like
Is
episode
it-
35 or 6.
Yeah.
I'm not necessarily doing 90 days. I'm just like being a little bit more conscious of like, do I like you? Do you like me? Are you showing
Yeah.
me the things that I want from a partner?
Got you. Got you.
You know?
Got
And if
you.
not, fuck right off. Go fuck yourself. You know what I'm saying? That's my wine of the week. What's your wine of the week, Dr. David Clay?
So I was thinking
fun.
about it. I didn't, you don't have to call me Dr. David Clay. We don't, by the way, physical therapists don't go as Dr.
Oh.
David Clay. Like, I'm David. Usually the
Mr.
doctor.
Clay?
Just David. because if you're going to put the mystery, you might as well put the doctor. But with no prefix, right? Just David. I have like
Okay.
kids that'll say like Mr. David
Okay.
in the clinic. But if you get a therapist that says like, oh, you got to call me doctor, just maybe consider other options.
Okay.
They're just like, if that's what they're worried about the most, right? Because we don't want to confuse patients into thinking that we can treat things we don't.
Okay.
We don't do surgery. We don't like diagnose.
Right.
Like
Okay,
cardiovascular disease.
might be.
No, I'm just for clarity, right? Like
Yeah.
for different things. And yeah, so just that, right? But
Okay.
as far as wine of the week, I didn't think of one until driving over here. But recently, over the last like 6-7 months, I bought a truck. I live in Texas, so I was like, I gotta get the truck. Just more space.
It's a
I got
nice
2
truck.
big dogs. I enjoy it. Besides the gas, I enjoy it. But driving a truck, you realize how much like people in cars have no respect for the amount of space that your vehicle takes up. So they'll do things that are just like they don't think about because they drive cars. And I'm wondering if I used to do it. I moved into this apartment. For my first time, I live in an apartment with a garage.
Okay.
You have to drive up the ramps. And I'll be driving, and I make sure to stay as wide as I can. And you have cars, Volkswagens, just busting out super wide. And then we both end up at this stop, and I'm like, I
As you're
can't
going
move.
around the
Yeah.
turnaround.
I can't move. You got to literally back your car up and get in your space. Because my truck, this is as tight as I can get.
Mm-hmm.
And then they like get a little attitude. And I'm like, move your vehicle. The other day I was coming down the ramp.
Move your vehicle.
This woman was like, she drove an Audi, but she's parked in the middle of the like 3rd floor ramp. Hazards on, just outside talking to someone. And I'm coming around and I'm like, well, let me try to squeeze my like tiny ass up around here. And she just like stares me down the whole time. And I'm like, if my truck compresses you against your Audi, like that's on you because you parked in the middle. There's not enough space in these like tight garages. They build to fit as much as they
Well,
can.
don't you
in
think
these
that
little
you
spots.
might be the problem then with your big ass truck?
No, absolutely not. Who are you going to call when you need something moved? I need this couch. I need these chairs.
Yeah,
But
true.
you can't drive on the Houston highways with a car. Like everyone who does, look at the bottom of your vehicle and look at the panel that's just hanging down.
My panel is fully in place.
That's what you think. When's the last time you got under there and really looked? How's your car suspension?
Honestly, never. Honestly,
Like-
never. Right now, the heat has fucking messed up my tires. I have to inflate my tires.
Do you think it's the heat, or do you think it's you hitting like the potholes and stuff, and they're so small in the city?
That maybe.
Yeah.
Okay, fine.
I barely was able to fit my truck in the parking spots, but I might have scuffed the BMW out there.
That's my car.
I know.
Where did you park, by the way?
Oh, am I gonna get towed? I parked in between you and the red car.
It's not a spot for you.
Is there?
My neighbor who listens to this podcast, that's her spot.
I'm so sorry.
Sorry, Ana Maris.
I thought you didn't tell me about guest parking. What kind of host?
What kind of guy just parks in any random spot?
There's a parking lot. There's a parking spot. You have a tenant that's not there right now. I figured this might be that space.
There's a new tenant.
Oh, you
How
didn't-
did you know?
I mean, I thought I would get an email of like different, like here's the parking instructions. I've driven over here and I've parked in those spots before.
Not that spot.
Not that spot, but I've
The
parked.
first two spots are guest parking.
Does it? Did they say guest parking on them?
No. Anyway, we gotta go because Dave has to move his car. Anything else you want to say?
No, I mean, thanks. It's been a pleasure being on the podcast.
Yeah.
Thanks for finally asking me to be on the podcast. No, I'm just
I
joking.
didn't know you wanted it.
I know. No, thank you. I appreciate it.
Yeah.
This is pretty awesome. It wasn't something I was like, I need to be on Paige's podcast. But such an
Don't
honor.
lie, it was.
Such an honor to come after like those other guests you had. Like, what was it? Love Island, the counselor from
Married at First Sight.
Married at First Sight.
Yeah.
Like, counselor from that. You had like the woman who works with Jim Beam. Like, she's moved up the chain.
Mm-hmm.
Which I got to go back and try it because I've always thought Jim Beam was like a cheaper liquor.
I think it's Jim Beam.
Jim Beam. I'm saying like Jimmy Dean, like the sausage, but Jim Beam. I need to go back and give it another shot and look at some of their higher end stuff because
Yeah, you'll like it because you're a cocktail
yeah,
guy.
even though you were being stingy with the cherries the last time I was here.
They're expensive.
I know. I should bring you some.
You should have. It's okay. You brought wine. But no, thank you. I appreciate you coming. Do you want me to shout out your Instagram or are you private?
I
Are
think
you that guy?
it's
Do you
honestly
wanna-
it's David.Clay.
Okay, if you want to follow David.Clay, if you want to come to our volleyball games, come on over. If you want me to get food out of your teeth with my hoop earring, holla at me.
gross.
Usual. Follow me on @adultishwines on Instagram @Paige_Crutcher. Don't forget to check out the merch on adultishwines.com and Cinco Young on Instagram and Spotify and all that stuff. I love you guys, and I'll see you next week. Bye.